Thank you very much, Bangani, and we're looking forward to those insights. The first case study that we're going to listen to is the Gauteng province, presented by Carmel Joseph and supported by Ismail Akhalwaya. And over to you, Carmel.
Our esteemed guests from the GTAC, the DPME, the NRF, and thank you so much, Tabo, for facilitating our conversation today. Um, um, I think as I'm getting older, I seem to be getting a little bit more sentimental because I kind of get emotional at events like this because it's just taken me back to probably about a year ago when we started on this journey of the development of the Gauteng provincial case study. And to me, it's quite exciting that we are at this point today where we get to present some of the findings, but that we also get to interact and hear from other provinces about what they did in response to this pandemic in the last year. So I think for me this is quite auspicious, and the fact that we, including tomorrow, will also start a conversation about how we continue to collaborate across the provinces. For me, that's very exciting. So let me get into the presentation. So as Bangani already said, we were given a couple of areas that we needed to look at, and so that's how we've tried to capture the contents of our discussion. I must just drop in a small disclaimer to say, this case study took us, I think, over 6 months of work of a number of researchers. It's 180 pages long, and I've got about 30 minutes to go through what the key findings and the learnings are. So I'm going to try my best to do that, but I just wanted to say that for the purpose of this discussion, we will probably keep it at a very high level. And then tomorrow I think we'll have an opportunity to look at some of the detail. But I do want to encourage the colleagues that are on the call to please use the chat facility or the question and answer facility to ask questions, because we will have an opportunity after the presentation to respond to some of the questions. So just to get into it, so the background obviously is we all know why we are here. More later, is that we were just hit by this unprecedented event. And by around March of last year, the World Health Organization actually declared it a global pandemic. And that was quite important for us as a country, because the declaration of this, the outbreak as a global pandemic, then resulted in the South African government taking a number of very swift steps to respond, the first of which was to declare a national state of disaster. And that enabled the country to kind of, in a way, do the things that we've always needed to do and we've always wanted to do, which was to integrate and coordinate our efforts towards a particular goal. It was just, in this case, it was a crisis that really brought us together. And it also gave us an opportunity for all spheres of government to start to collaborate with partners outside of government, our social partners in the private sector and so on. And we needed to do this because when we went into that hard lockdown in March last year, we were all vulnerable and we all needed to respond to the vulnerabilities that came with the pandemic. And then, of course, we had to respond as the provinces and as the local government. But I don't want to go into too much detail around that. I want to come back to the case study, because I think what happened for us in Gauteng is that we very early on realized that this was something unprecedented that we are faced with, and that it would be important to document it. So we started talking about the writing up and the development of a case study very early on. I think probably around April or May of last year. And really our intention was that we wanted to record what the province did in response to the pandemic, so that we would have a kind of a historical record, something for posterity, I suppose. And then we also wanted to document the lessons from the response, so that, you know, we would be equipped to, in a way, deal with future crises. But also we thought there would be interesting lessons that would come out of this response that we might be able to apply to other areas that, you know, what we call the wicked problems, areas that we've been struggling with for many years. So that was really the intention. And as we were thinking about doing this, we also had discussions with the GTAC in the National Treasury, who were then reaching out to us to say, you know, we've got, we are able to support you, and we've got the NRF who will be able to support you with some research. Do you have ideas? And that's kind of how that conversation started, and the idea of the case study was born in this way. And so we are very grateful for the fact that we were able to collaborate and to partner with GTAC on this case study.
Yeah, okay.
So the aim, as I was saying, it was very broadly to capture the interventions that were adopted by the Gauteng city region we started to talk about, which would include the Gauteng Provincial government, but also the local government. So in our case, it would involve the metros and the districts and local municipalities. And to see how it was that we dealt with the health and socio-economic impact of the pandemic, and then of course to document the lessons that came out of that. And I think to focus on it as lessons is quite important, because we don't only want to talk about the positive that has come out of this, which is of course very important, but sometimes the best learning come from our failures, and learning to work around that and how we take those lessons forward. So that was kind of the overall aim. Some of the specific objectives was then, as I said, to establish what measures were put in place to respond, to reflect on the effectiveness and the impact of the interventions that were put in place, and to document the various contributions in particular of our social partners and other institutions. And I think when we reflect on some of the learning later on, I think that was an important learning for us, where we could have done better, in fact. And then the idea was that we would document this in an accessible way, you know, for future learning. So we are actually currently, the document is being edited as we speak. As I said, it's about 187 pages long. So we are editing it, and we're hoping to do a print run of the document as well. So the methodology that we used for the study, it was obviously a case study methodology. And it was done in a number of ways. First, through data collection. This was done through in-depth interviews with key informants. And I think we probably spoke to, in the order of around 60, you know, between 60 and 80 people. We saw sort of trying to source that information. But various interviews with key informants were held. And of course, it being a case study, the informants were very deliberately chosen because of the role that they had played. But we did try to get sort of a broad response from government, as well as civil society, to you know, including sort of business and other institutions, the non-profit organizations and so on that we worked with. And then, of course, it was also to look at what documents, through the desktop review, what documents were already available and what other tools were being developed as part of the response. Then, of course, the researchers did some data analysis, and then some, some findings were made, and some key conclusions drawn and recommendations made. So the structure of the document is that we've currently got 10 chapters. So Bangani Ngeleza, who spoke to us just a few minutes ago, was kind of our overall lead researcher on the project, and probably the lead writer. So he did a lot of the kind of consolidating of our document, especially in terms of chapter 1 and chapter 9 and 10 of the document. And then the other chapters we had through our collaboration with GTAC and the National Research Foundation. We then had a number of really senior academics and researchers working with us on the project. We had a chapter on leadership and governance, and that was led by the GCRO, the Gauteng City Region Observatory, a key partner for us, a research partner for the Gauteng Provincial Government. So it was very important that we participated with them. The GCRO, by the way, also led a number of governance dialogues, which also contributed in a big way to the write-up of this chapter. Then we had, of course, the chapter on the health response. That was led by Professor Letitia Rispel from the University of Wits, with a number of support researchers that worked with her. Chapter 4 was around the resource allocation, and that was led by Dr. Lungiswa Konke from Stellenbosch University. The economic response, Professor Ivan Turok from the University of the Free State, as well as the HSRC. Then the whole area, of course, of food systems and the food distribution that happened during this period. That chapter was led by Professor Hetty Skoenveld from the University of Pretoria. The education response, Professor Salumi Human Vogel from the University of Pretoria. And then we had a chapter on the communications, mobilization and compliance responses. And that was led by Prof. Rajan Mistry and from the University of Cape Town, and Prof. Leketi Makalela from the University of Wits. So as you can see, we really had a formidable team to work with us on this case study, and we were really grateful that we were able to pull these resources together at a very short, within a very short space of time, and at no cost to the fiscus. I think that's an important point to mention. So we are extremely full for that. Some of the sort of findings, and these are really just from our own documents in terms of what the Gauteng response was. And I mean, all that we're really saying with this slide is that, when it happened that the global pandemic was, it was declared, we had to really get our ducks in a row to respond. So by the 23rd of March, I think, is when the president made, what did we call them? The family meetings. I think that was the second big family meeting where the actual hard lockdown was announced. And then a number of things had to kick into place very quickly, and we had to set up. And we were very fortunate in the province that we had Deloitte to work with us around just institutionally how we set ourselves up to be able to respond to this. And colleagues from provinces, I'm sure you can appreciate that, during this time there was a lot of uncertainty. I remember, as soon as the hard lockdown was declared, all of us kind of going home and sitting at home, able to do a little bit of work, but trying to figure out what the next thing would be. So we are really grateful for the partners that came on board and worked with us. The province very early on realized that whilst this was in fact a health crisis, that the impact thereof would be felt way beyond just health. And so the province adopted a 6-pillar strategy, which was obviously the comprehensive health response being the key, but then also food security and social relief, because there was, a lot of people lost their jobs fairly early on, and people that relied on being able to be out to fend for themselves were now more vulnerable than ever. So the food security and social relief efforts were important, state capacity and adaptation. And this is important even going forward beyond the pandemic, is to say, how do we organize ourselves as institutions to be able to deal with crises and with difficult situations? The economic response, no doubt that was one of the biggest impacts, and felt in particular by in Gauteng with the number of job losses. I know at some stage we were talking about 600,000 job losses just in the province in that short period of time. Social mobilization and human solidarity, and then law enforcement and compliance, and just making sure that all institutions were complying with the regulations at the time. The operating model that the province adopted then looked something like this. Now, it might look a little bit confusing at first glance, But essentially what it was saying, how do we, in a very coordinated way, bringing on board all the relevant partners that need to work with us, respond to the crisis. So at the very sort of top level within the province, at the political level, there was the Premier's Command Council. That's the PCC that you see right on top in the middle. And that was... that is chaired by the Premier. It still meets, even now, they meet on a weekly basis. That was set up by the Premier, and the mayors participated, and the relevant national departments also participate in that committee. So sometimes we would have ministers participating there. Then there's the PDMCC, which is the Provincial Disaster Management Command Council, and that's made up essentially chaired by the DG of the province, as well as the MEC for Health, and all departments are represented in that structure. So heads of departments and senior officials would participate in that structure. Initially, when it was set up, it met daily. And sometimes for a whole day. So there were lots of meetings that happened initially up front. At the moment, the PDMCC meets twice a week, and it still continues to monitor and coordinate the efforts around the response to the pandemic. On the far left, the different colored boxes that you see there, those are the various work streams that were set up to kind of deal with the detail. So when the PDMCC and the PCC meet on a weekly or twice a week basis, the reports that they are considering would be from the work stream. So it was within those work streams that the details of the response was being discussed. And we think that this was quite an innovation for the province. And as a province, we're actually looking right now to ways of how we sustain our ability to work in this coordinated fashion, both across the departments within the Gauteng Provincial Government, working with other spheres of government, and then also to work with non-state actors. So we're quite proud that we were able to pull that together in such a short space of time and how well it worked. So one of the findings that came out of the case study, of course, was the issue of the establishment of routines and escalation structures, and that was essentially what the structures that I just put up. And colleagues, I know I might be flying through some of the information, but we will share the written case study with yourselves, just to make sure that you also have some of the detail. But so we think this is quite an innovative. The assembly of these structures was quite an innovation for the province. And as I said, we would like to continue to see how we can capitalize on working in this way to deal with other issues that might be plaguing the province. And I think I've already gone through just what the structures are and how they worked and how often they met. Another key finding which was important in the work that we had done in response to the pandemic, was around leadership. So there was a key role played by the Premier in particular, and the Premier really seen as the champion of the COVID response in the province, and the DG. And I think that was an important element as well, was recognizing that this was more than just a health crisis, and that the impact would be felt broader. And I think it was through that leadership and how that, so if you look at how that structure was set up, it wasn't only looking at the comprehensive health response, which obviously was important, but the other areas as well. And the other point we wanted to make around leadership here is that whilst there was that incredibly good leadership role being played at the top level within the province, and I also should add by the mayors in the various municipalities, the metros and the districts. It's also we need to acknowledge the competent management that happened at our institutions in the hospitals. I don't think it's a secret to say that the health department in the province had been plagued by a number of crises leading up to the pandemic. And I think the fact that our health system as a whole did not collapse is in large part due to the local level innovation and leadership that was shown at the institutional level in the hospitals. And this is something that's quite important for us to note, because I think going forward and how, just in terms of how we continue to build and strengthen the health system in the province, this is going to be an important ally for us. Some of the other findings, again, so of course there were the existing IGR structures and frameworks in place, and as we said, when the disaster was declared early on, the Disaster Management Act and some of those structures kicked into place, but it was very soon realized that it was inadequate for what we needed to do. And so again, the innovation is important. Collaboration with non-state actors, I think we did mention this. I think to some extent, though, an area that we didn't do so well in was around just the collaboration with, in particular, the private health sector. So of course that's something that we're going to need to continue to build on, as well as the NPOs. We were quite criticized quite severely by some of the NGOs and community-based organizations, for example, in how we dealt with the issues around food distribution. And so we really want to, going forward, look at how we strengthen those relationships. And we always talk amongst ourselves as the officials to say that, some of these things, there are organizations out there that have already done this kind of work, and they do it well. So we don't need to reinvent the wheel in some of these instances. But having said that, there was obviously a lot of uncertainty, and if you are government and you're going to be judged on how well you respond, in some cases you would want to get your hands dirty where sometimes it might not have been necessary to do so. And then, of course, the use of data and science is incredibly important. So in the province, the Premier set up the Premier's Advisory Committee on the COVID. I think if colleagues are aware, the Premier held those weekly briefing sessions where he briefed the media. And at many of those sessions, the advisory committee members, so the scientists and the experts, would actually be the ones to lead some of those presentations and conversations. So I think this was an important lesson for us, even going forward, around how we start to implement what we call evidence-based decision-making, and how we bring on board the science and the expertise in the work that we do. As I've just mentioned, the Premier with his weekly media briefings, so that was quite important. So there were lots of positives around communication, in particular with the work that the Premier spearheaded. But there were also some failures that have been picked up in the case study, just in terms of how well we communicated with the public and brought the public on board in some of these areas. And then I think also communication around some of the relief measures that could have been done a whole lot better. So it wasn't all positive. There were some negatives, and we really want to take those on board and see what we can learn from it. What we think worked well is that, and this is not by our doing, we were forced to just be very focused in our response. Often I work in the office of the Premier in a unit called the Delivery Support Unit, and our job is really to look at the key priorities in the province and support the line departments to achieve. But a key challenge for us is the issue of prioritization. We want to do everything for everyone, so we've got 110 things always on our desks that we need to attend to. And this time around, we didn't have that luxury. We had a crisis to respond to. There were lives and livelihoods at stake. And so that's an important lesson for us, to say that when we focus on just very key priorities and work towards it with intensity, good results can be achieved in a short space of time, and we don't want to lose that particular lesson. What we also think worked well, and maybe it's an advantage that we were in Gauteng with sort of good network connection and so on, that we could basically go virtual almost immediately. I mean, MS Teams, the uptake of that was incredibly fast. And even now we are all mainly able to work from home, and that, you know, and we see that for the foreseeable future, that even in the way that we're meeting today, that this might be how we do things going forward. Of course, the collaboration across spheres, but also across the departments, and the breaking down of some of the silos. We thought that that was good work that was done, and this was primarily through the Office of the Premier, if we have to sort of pat ourselves on the back to say we've done that quite well. The area of adaptive governance, the speed, the swiftness at which we were able to respond to the crisis, which is not to say that everything that was done was excellently done, of course, but at least we were very quickly able to recognize what the need was and set up the necessary structures. The use of data and experts, as we've mentioned, the fact that these processes were spearheaded at the very most senior level, and so the frequency and the swiftness of decision making was facilitated by that and strengthened by that. We've also, through this process, managed to identify some hidden talents and the willingness of officials in departments, and we certainly want to build on that. And as I said, the local level innovation that ensured that you know, we didn't, our health system didn't collapse completely. But of course, there are other things that wasn't necessarily done by us as the Gauteng Provincial Government. So, for example, the declaration of the hard lockdown. That really did assist us to ensure that hospitals were not overrun with trauma as we would normally. I mean, sort of on a normal weekend, that is what we would be dealing with, and this time around we didn't have to. So that really supported our efforts. What could be done differently? So as I said, it's not all like this rosy picture. So even though we set up these innovative structures, we don't think we've significantly changed the culture. And in a way, in some instances, I think people are waiting for the pandemic to go away so that we can kind of go back to how we did things before. So in some cases, there was a reluctance to share data and to collaborate. And of course, it's not easy, you know, when you feel that others that you wouldn't normally work with now have access to your information and to how you work. You feel judged, you feel criticized, you know. And of course, for us, that's important if we're going to learn going forward. Some of the other, of course, we can't ignore the regulatory lapses, in particular around the PPE procurement that happened in the province. And so that's huge scrutiny that needs to go into that, and understanding what those lapses are and how we prevent them going forward. Then there are obviously also, even though these structures were set up and often worked very well at the political level, I think there is still some more work for us to do between ourselves, how we work as the Gauteng Provincial Government departments with municipalities, and then to avoid kind of stepping on each other's toes, and have a much more cooperative way of dealing with some of the issues. And then, as I've said before, a huge criticism for us was around the how we worked and brought civil society in earlier, in particular around the issues of food distribution. Some of the recommendations that we want to make going forward, and I think a lot of this we will in fact pick up in our discussions tomorrow as well, is that we want to retain some of the good. So, you know, the governance architecture that we've been able to pull together, we want to look at how do we sustain some of the good practices that have come out of that. And as I've said, even though we've set up some of those structures, we haven't necessarily yet changed the culture of how we work together and collaborate across institutions. So that's an important area for us to look at. And then tomorrow, the colleagues from GCRO will share with us some of the work that has come through in the governance chapter. We think it's important to initiate some kind of inquiry to understand why it's taken so long before for us to be able to deal with the wicked problems. And as I said now, this time around, we didn't really have the luxury. We were forced by a crisis to respond, and we did. And so now we want to sort of draw on some of the lessons from that, but also understand what some of the underlying issues were that prevented that from happening before. And I think tomorrow, when we look at, in particular, the case study on the functional beds in hospitals, I think probably we'll get into a little bit of that initial kind of interrogation around those areas. Of course, partnerships with the private sector and other agencies. I've mentioned that a few times, and we definitely want to look at how we strengthen those. And then I think very importantly, we want to strengthen our research, technology and innovation capacity to be able to support service delivery, the kind of evidence-based decision making and so on. And of course we know that a lot of this kind of capability does not reside in government right now, so it will require us to collaborate with partners, and the partnership and the collaboration that we've started with GTAC and the NRF just on the writing up of the case study is an area that we would like to continue to build on going forward. And then I think I did mention it previously as well, but to say, when we were focused and we didn't have the luxury of looking at 110 other priorities, we were very focused. We were able to bring the whole of society together to respond to a particular crisis. We worked at a particular intensity. And we believe that if we could kind of replicate some of that in response to some of the very key challenges that we are facing in service delivery in the province, that we would be able to produce some really good impact for citizens. And so those are really the things that we want to draw out of what has been captured in the case study. So at a high level, I think that's what we've been wanting to say. As you can see, it is at a very high level, and one would have to go and read at least some of the 8 chapters just to see what some of the subject matter, what some of the specific issues are there. And our intention is really to use this document as a basis to then say, what further interrogation do we need to do? And I think from tomorrow's discussion, you'll get a sense and a flavor of at least 2 areas of work where we have started to do a little bit of more in-depth work. So, Tabo, I'm going to pause at this point. I'm not sure if I probably took a little bit less than my allocated 30 minutes, I hope. And maybe we'll give an opportunity to the colleagues to ask questions and maybe even to just raise comments and discussions, because all of this is part of a learning exercise. So it's not that we have all the answers. And I'm with my colleague, Ismail Akhalwaya, and so between the two of us, we'll be able to respond if there are specific questions.
Great.
Thank you so much.
Great. Thanks very much, Carmel, for those insights. And there are some questions coming through that we'll take. You take at the right time, you stopped at the right time. So the first question is that you indicated that we've lost 600,000 jobs, and the research is showing that the economy is going to be slow when it comes to recovery. Is there new statistics that have come up to show us where we are?
Okay. I'm with some of the colleagues, even from DPME, so I think we can respond. Yeah. So maybe we'll allow the colleagues from DPE maybe to start, because I think the latest QLFS has been released, right?
Great.
Yes, of course. Yes, of course, there is various sources of statistics that are coming through. On the health front, the Department of Health, obviously they're publishing information every day since the start of the pandemic about the infection rates, about also related matters in that space. On the economy front, there has been streams of survey. There has been surveys that have been published at the national level by the National Statistics Agency, Statistics South Africa. They have run a survey, for example, on the economic impact of the pandemic, how businesses have been surviving. I think the survey that they published around March showed how incomes of businesses have been affected by the whole pandemic and the close down. There have been several studies that have been done by the Human Sciences Research Council on the perceptions of people around the pandemic itself, how they understood it. Even now they are running surveys around the perceptions around the vaccination. Just 2 weeks back, there was a study that Human Sciences Research Council, for example, published about the vaccine hesitancy, how people are reacting to the whole idea of vaccination, whether they are prepared to take the vaccination or not, and what is it that drives people. Those kind of surveys actually helps to craft communication, both by the experts around how the whole area of pandemic need to be understood, how people should understand the vaccination processes, but also it helps people to read what is happening in other countries. It's not only done in South Africa. In the US, for example, the past month, there's been a whole discussion around vaccine hesitancy, and the government has actually used that to craft communication to help deal with the misconceptions around these issues. Thank you.
And thank you very much for those insights. Another question relates to procurement. We know at the beginning of this pandemic, there were some reports regarding lapses when it comes to governance regarding procurement. The question is, are there new measures that have been put in place to avoid similar incidents going forward?
If I have to react to that, there has been tough lessons that have been learnt from the initial process of procurement, whereas Treasury has created processes to make it easy to undertake what is called emergency procurement during the Covid-19. There were mishaps here and there that have taken place, which diverted the attention from the work that needed to be done to now dealing with the issues of corruption. What is happening now is that it has been very useful that there was a process of publishing the names of procurement, the list of procurement that was done across the country on various things related to COVID-19. Right now with the vaccination, the process that's being undertaken at the national level is the corruption risk assessment, especially regarding this issue of procurement, that a decision that has been made by the interministerial committee that is chaired by the deputy president is around there should be transparency around procurement in this regard. So the office of the chief procurement officer in the National Treasury is the one that is responsible for making this information public, so that there is also a transparency and public scrutiny on what is happening in the procurement space.
All right. Yes.
I think it was necessary to respond quickly to the pandemic and to open up and to have a faster procurement process. Mm-hmm. But I think as a country, we probably need to look at how we deal with this in the future. So, I think people are scared because of the public outcry, because of the media, the corruption stories. I think officials now are in a bit of a bind, that they're scared to take risks. And the AG is watching over all of this. So we need to find a balance between responding quickly within the ambit of the law, but ensuring that we, there is services that are being delivered at speed. Okay. So I think, discussing with the AG around how can you be flexible in an environment, in context like this is crucial. And I think as a country, we haven't quite solved it, but I think it's lessons that we have to basically build on.
Great. Thank you very much, Ismail. It's very clear that to deliver a project of this magnitude, you need multiple stakeholders just like you highlighted that you collaborated with non-state organs or private sector. So there's a question here as to what lessons have we learned by collaborating with the private sector on things such as food distribution?
Well, I think, the big lesson for us is that government can't do everything. Government needs to create the environment for others to also play a space. And where you have the private sector or community-based organizations who are much closer to communities, I think we need to rely on them, and we need to find ways to bring them in much more effectively. So I think trying to manage things from a center, from a government perspective, is not always ideal. And yes, partnerships, especially in times of crisis like this, is crucial. So I think it's a big, big lesson for all of us.
All right. Thank you very much for that. And as we go along, we collect a lot of data that needs to be analyzed to give us some insights. Are there any constraints that you have experienced when it comes to that data, whether it's collecting it or analyzing it?
In the space of data collection, you would know that certain data has to be collected with using methods that involves personal contact. Though obviously that space has been affected. But then again, there was innovation in the space of information and data sharing across organization. You would remember the data center that is located, the CSIR, Council for Scientific and Industrial Research, has played quite a big role. Even the president visited that facility early last year. It created a very important space for learning and for data sharing, and also modeling in terms of how the pandemic itself was unfolding in South Africa. That has been one of the greatest developments through this pandemic space. We've also seen the case of Gauteng, the collaboration that happened between the Gauteng government. Maybe you might want to speak about that. The Gauteng government and the VETS university with the GCRO creating databases that enable us to look specifically at to zoom into specific localities to understand the vulnerabilities of communities. There's been a number of exploration of data that enables us to have new insights about what is actually taking place.
Yeah.
You might want to
Yeah.
elaborate
So-
on the Gauteng issue.
Yeah, I can comment about that as well. And of course, in the presentation, we couldn't really get to that level of detail. But one of the supporting sort of work streams that was set up was to look at the issue of data. Initially, I think in terms of the sort of tracking and tracing of the testing and so on, but later on also kind of geolocating some of the data. So so the Itemba labs at Wits University, the collaboration with the Gauteng Provincial government and the GCRO, as Godfrey has mentioned, that was a crucial partnership for us in this instance, and very rich data that has come out of that. In fact, probably what we should do, Ismail, is share some of the links with the colleagues just to be able to go in and look at some of the information that we've been able to collate as part of the response. But something that was really interesting for us as a province was that, remember the PDMCC meetings that I spoke to, I think at least at one of those meetings every week there would be some discussion around sort of the latest data and insights in particular that would have come through the research. And that was actually really crucial throughout the process. So GCRO on a regular basis would actually as the information comes through around the positive cases, we could actually geolocate it. And sometimes they would go right down to the district level and even institution level. So at a particular time during the pandemic, it became obvious to us that there was a particular issue, for example, in the facilities where older people, for the facilities for the elderly. And that was really key for us, because then it also it directed and guided where the response needed to go next. And that's going to be critically important for us in terms of how we use this kind of research in evidence-based decision making as we continue to talk about. So there's still a lot of that important work that continues to be done in the Office of the Premier. We do have a GIS unit within the Office of the Premier that continues to do some of that work in collaboration with our partners. But I think probably, once we start to kind of filter through the case study, some of the areas that we want to continue to work and strengthen and improve on, I think the issue of data and the utilization of data in decision making will continue to be important.
Great. Thank you very much, Carmel. There is a point that you highlighted in your presentation, the adaptive governance. Given the environment that we are dealing with that is ever changing, it's not only organizations that needs to respond to the environment, even governance policy needs to respond to that governance. So what are the key success factors when it comes to adaptive governance?
Okay, yeah, I think when coming to the issue of adopting governance, I mean, we have observed the number of structures that were established at national level, starting with the National Command Council, going down to the provincial as well as the district, which assisted in relation to coordination of all the interventions that need to be done with regard to the pandemic. And I think it's one of the lessons that has been highlighted that is going to be taken forward in terms of similar intervention that will be required, whether to accelerate the issue of service delivery. There's a need also to have a good, proper governance and coordination. I think also the issue of the IGR, it came into play as highlighted, that was one of the structure that also was able to be applied successfully to ensure that there's a proper coordination. Thank you.
Great.
Can I just
Thank
say
you very
beyond
much.
that,
Yes, sir.
I mean, government is a very complex, rule-bound structure that you're dealing with. But when you're dealing, and a lot of the things we do is very formalized, etc. But adaptive governance means that, when you have a challenge and a problem, is to kind of look out for partners, to work with others, to bring in people with expertise, and to realize, I mean, as Carmel is saying, that, we don't have all the answers. We have to reach out to others. And to get integrated, working with other departments, other spheres is crucial. And that's the only way you are able to kind of reach out. And a lot of it depends on having the right skills. The people within government who are willing to go out and look and find solutions and problem solve. So yeah, I think that's, it's something that you do continuously and very proactively.
Thank you, Ismail. You wanted to say?
Maybe to add, you see, the way that the structures that Dr. Makado has indicated of the national corona councils and all the structures, the NAT joints, there was a whole lot of meetings that were held coordinating work that is happening across the government, the whole of government, and at different levels as well. So using online platforms, which under different conditions before COVID happened, it would have taken quite a lot of time to get all those people together to discuss same issues and resolve certain issues very fast. So that has been one of the important lessons that we are picking up from this COVID environment, that we have now found new ways of working from wherever we are to interact and solve important problems in a very short space of time, coordinating across various structures. Thank you.
Great. Thank you very much. We've come to the end of the Q&A session, and we're going to take a comfort break till 10:30. If we could please be back by 10:30 promptly, please.